reasons why we thought Praktice.ai was, well, hi everyone, welcome to the companies in the CRM category as a whole, and why we're super excited about the things that you're doing is because you guys are building a number of features just beyond patient triage. You are doing this onboarding and managing requests, you're scheduling care, you order ancillary services, there's telemedicine component in all this, you can check symptoms, etc. So I'm just curious that maybe you might want to highlight some of these features, and is your goal to really just manage the entire care process out of all of this?
Sure. I'll just use a different slide for this. Probably, yeah, this is a perfect slide to explain this. Absolutely, Kyle. It's a very, very important question. So when one looks at the whole set of features that we are offering to these hospitals and health systems and providers, it looks like a lot of features, right? A lot of different products. But to be precise, it's one single product which has a connecting thread of a patient medical need. So when we look at the whole journey, we look at it as a single thread of one patient coming to a hospital or a doctor for a specific problem, seeking care to become healthier again. That patient thread needs to be connected to each and every process. And what we are doing is there are already processes built in. We are not really reinventing or recreating the processes. However, we're just trying to ensure we plug that information that we collect from the patients in a conversational format into those various processes so that they'll become more efficient and the whole journey becomes much more seamless. So when you look at this, the care navigation journey on the slide, the digital front door is the initial or the starting point where the patient says, I'm visiting this problem for this, the doctor for this problem, or I need care for this problem. So that's where the first medical understanding is. And we use that to really understand if a patient is undergoing an elective surgery, whether their insurance is eligible to cover the service or not, how much copay they need to pay, who's the right provider, do they have a referral, is it valid, and let's say giving the consent form and ensuring we get the registration process done before patient comes to consultation room. So all of that is just a connecting the dots in these processes and filling in the information which is missing in these processes. So thereby we're not really creating any change in the operational process, or not really creating any parallel process. Rather, we are enabling the process to be much more clinically aware, much more intelligent, based on the medical knowledge that we bring in, and also pass that information back to the EHRs so that the whole e-prescription or the doctor's, let's say, care delivery becomes much more aware of the patient's medical context, right? And we also want to use this once the patient leaves the consultation room to the post-consult. So there's a single thread of the patient by connecting the various pieces, and it's not really a discrete set of various features that we have built.
Really interesting. Yeah, I think this is a great visual for talking about how the roadmap is going to really encompass that whole process. And it looks like you guys do intend to expand into outpatient care and follow-up. Is that the future? Seems like it is here.
That's right.
Okay.
That's right. So as a startup, we've been focusing on the pre-consult and medical case summarization so far. But with more and more resources to kind of at our dispense, we would be working on the post-consult space. Again, in the post-consult space, the good thing is we can concentrate by certain specialties, right? Let's say the chronic care, diabetes care, or I think the cardiology. So why don't you take that a little bit probably into deeper, Dr. Akhila? I think I'm not the perfect person to explain that.
Yeah, so in the post-consultation phase, as in when we'll be, starting with the post-consultation navigation, there are several, chronic care areas that we'll be specifically targeting, like the diabetic or the, cardiology, or even the, obesity or such, treatment related or surgery related focus areas, let's say orthopedic surgeries, etc. So this is again gonna be a lot more digital driven, in the sense that, analyzing post the discharge what sort of, symptoms that a patient is experiencing. Is it, not actually a complication of the, surgery or of the treatment that the doctor has provided? So monitoring the patient, digitally, as well as, making sure that the post treatment appointments are on time, and reducing the care gaps in the, overall process is something that we'll be, concentrating at a later point in time. But as of now, as Sri has mentioned, we are, majorly focusing on the digital front door, as well as the pre-consult navigation and the, patient intake journey.